Hi there, my name is Dr. Hooper. I'm one of the family docs here at PTHA Tribal Health Authority, and I'm here as part of the Doc Power Hour to discuss COVID vaccination and common myths related to the COVID vaccines that are available here in the United States.
Hi, and I'm Colrain Fragoso. I'm one of the nurse educators here at PTHA Tribal Health Authority, and I'm just going to be kind of helping out today.
Go ahead, Corey.
Okay, so we've got a little bit of a list of some of the more common questions or concerns that people have regarding COVID vaccines and children. And the first question that we have here, it's posed as more of a myth, but it says COVID-19 vaccines are dangerous for children. Can you speak to that a little bit, please?
Sure. So I think it warrants review, first of all, that there are currently three different vaccines that are approved for use here in the United States. The Pfizer, Moderna, and Johnson & Johnson vaccines. The Pfizer and Moderna vaccines are mRNA-based vaccines, which is a relatively new vaccination technology that's been around for about 10 to 15 years. It is novel in that it's the first time used for a human vaccination program. And the Johnson & Johnson vaccine, which is a more traditional based viral particle vaccine. And of those three, the Pfizer vaccine has been approved for use in children as young as 12 years of age, so 12 to 15 and 15 to 18 age groups. So there was an initial approval about a month and a half ago for ages 16 to 18, and then more recently down to age groups 15 to 12. So the common myths about vaccines being dangerous for children, I suspect came from the fact that with the initial studies that were involved in the emergency approval for Pfizer, Moderna, and then later Johnson & Johnson did not include younger age groups. And for that reason, we had no data for or against its efficacy and safety in children, and that was the reason that it was held. And for the same reason that it was held for pregnant women, because there was no testing with pregnant women. That's since changed somewhat. It's now, largely based on recommendation with the obstetric provider, whether or not the mother should get the vaccine while pregnant or delay until after pregnancy. But with regards to safety and efficacy for children, the studies have now been done, and they do show good efficacy with no demonstrated significant side effects. And so for that reason, it was approved down to the age of 12, which is the minimum age of participants in the testing that was done. In the future, we can expect the recommended ages to further decrease, but that depends on the demographic age groups in the studies that are currently ongoing. But I anticipate longer into the future, we will have vaccination for children of all ages. But that remains to be seen.
And kind of along the same topic is the thought that are COVID vaccines really necessary for children because the virus doesn't really affect them?
Yeah, so I mean, it makes perfect sense to kind of think about it that way, right? Because we often see in news media or through personal experience, if we have family members or friends of children who've been infected with COVID, they generally don't have significant or severe clinical progression of illness. Oftentimes they can get ill, have mild to moderate symptoms, and then resolve pretty quickly. But there are rare cases where children have very severe and potentially fatal consequences to the virus. And we yet don't know the long-term consequences of having had the COVID infection. And so for those reasons, it is recommended that children get vaccinated to protect their long-term health from the yet undetermined long-term side effects of a COVID infection, and more broadly to help prevent communal spread and contribute to communal herd immunity. Like many other illnesses, children tend to be a major vector of spread within communities because, you know, as we, I'm sure all have experienced either in our own lives when we were youngsters or through family members, friends, or acquaintances, children aren't as good about washing hands, maintaining appropriate social distancing or cleanliness without parental supervision. And it takes a lot of reinforcement, especially early in their lives. They just don't know better a lot of the time. And for that reason, children of school age, particularly younger children, often tend to be areas of spread within communities, whether it's, you know, seasonal viruses like flu and rhinovirus, or things like coronavirus. And that's why, you know, schools having closures across the country was such a big deal early in the pandemic last year before, you know, adjustments were able to be made with social distancing within classes, mask wearing, and you know, all of the other logistical planning that was necessary in order to account for that. But children, by nature of being children, are often vectors for disease, meaning they tend to get sicker more often and they tend to transfer it to other people, including bringing that disease home with them and infecting other family members of the household, their parents, and if there's a multi-generation household with grandparents or great-grandparents, putting them at risk as well. So the COVID vaccine is the best thing that we have to prevent against communal spread of illness, despite all of the other parameters that we've put in play, like social distancing, mask wearing, school closures, limitation of business hours. But now that we have studies that show both efficacy and safety for children, it is the next step to offer a more broad coverage of immunity to all ages in the community that are eligible for it.
Yes. So what if my kid already had COVID-19? They had it back in January of last year, or they had it last month. Do they still need to get the vaccine? And if so, how long do they need to wait after they've had a diagnosis?
So this is another very good question because it's a common one for our community in particular who's been exposed or infected. The current recommendations are to get the vaccine even if you've had prior exposure and or evidence of infection, because while rare, there are known cases of reinfection after an initial COVID infection. And for that reason alone, it's important to get the COVID vaccine because there's up to 90% protection from a recurrent infection. And as well, it can help to reduce symptoms if you were to get reinfected. And so for those reasons, it's strongly encouraged that persons, children or adults who have had prior history of COVID infection get the vaccine. The other reason is that, again, we don't know how long the immunity, if there is an immunity, which it appears that there is, from a real life infection, we don't know how long that immunity will last for. And so getting the vaccine is meant to provide an extra backstop in case the natural immunity is insufficient. We provide a mechanical immunity, if you want to think about it that way, through the vaccine, which presumably should be at least as long or longer than an innate immunity from a real infection.
So how long do they need to wait if they've had COVID? How long do they need to wait after that to get vaccinated?
If you've had COVID, you need to wait a minimum of 14 days, which is the symptomatic phase of illness. And the reason for that is that we don't want to compound the illness by exposing you to the vaccine, which itself can have some side effects, which can manifest a worsening course of a current illness. So we want to make sure that the patient is fully recovered before providing the vaccine, and that should be a minimum of 14 days with resolution of any fevers and overall improvement of symptoms.
And kind of along those same lines, timing other vaccines, can kids get a COVID vaccine before or after another vaccine? What's the wait period? Can they get two at the same time?
You know, at the outset of the vaccine program, once the Pfizer and Moderna vaccines were initially approved, there was recommendation to delay other vaccines for 14 days from the time of COVID vaccination, or vice versa, if you had other, childhood vaccinations, to delay 14 days until coming back to receive the COVID vaccine. And that was out of an exuberance of caution, just to make sure that there was no issues with co-administration until further study was done. Those studies have been done, and it's been shown to be safe to take with other vaccines. So similar to your childhood vaccinations, your 2-month, 4-month, 6-month vaccines, or your booster shots during your adolescent and college years, it's certainly appropriate to get a COVID vaccine along with those. You no longer need to space that 14-day period.
Thank you. When we do have kids that are vaccinated in the household, as well as adults that are vaccinated, do we need to worry about them shedding the virus or potentially sharing that from the vaccine to vulnerable people that aren't able to be vaccinated?
So the short answer is no. The longer answer is that the reason why you don't need to worry about that is that, vaccines by their nature expose the body to indicators that are associated with the disease particle itself. So in this case, coronavirus of COVID-19, SARS-CoV-2, which is the particular virus that causes COVID-19. You require all of the constituent parts of the virus in order to cause an infection. And with vaccines, whether it's an mRNA-based vaccine in the case of Pfizer Moderna, or if it's a viral inactivated particle vaccine in the case of Johnson & Johnson, none of these provide all of the constituent pieces of the virus that would allow for an infection. They only create an exposure to the body through presentation of spike protein that then allows the immune system to respond to that spike protein by creating antibodies, which are essentially memory mechanisms for the immune system, such that if it were to see that protein at some point in the future, it could immediately respond to it and attack and kill it. But the protein itself does not carry any genetic material of the virus. It doesn't cause any significant illness that we concern ourselves with the true COVID infection. What it can do is produce a pretty strong immune response, which itself can be symptomatic with things like site irritation, swelling, muscle aches, and then with generalized immune response side effects like nausea, vomiting, headaches, body aches, general fatigue. So I hope that answers that question.
Yes, certainly. And then we have some questions. Can you hear me there?
Yes.
Okay, sorry, my screen just went down.
Yeah,
we do have some questions and concerns that I've heard, especially in the youth group, that are wanting to consider being vaccinated, but they've heard that it can potentially affect fertility, whether that be with a current pregnancy or with pregnancies far in the future. Is there anything to that?
So, to our knowledge, there is no long-term side effect to virility or ability to procreate after taking the vaccine. I think, I can't say for certain where this myth originated from, but I would imagine that it originated from concern with potential manipulation of your genetic code through exposure to vaccines that have genetic particles in it. So it's somewhat complicated to explain, but the essential root of the miscommunication, I suppose, is that each cell in your body has a nucleus, and within that nucleus is contained your genetic code, your DNA. DNA is double-stranded genetic material, and it has a quadrivalent coding system, A, C, T, G. And in those combinations, they code for different things, essentially proteins that your body is then able to make a copy, a single-stranded copy of the DNA into mRNA, which stands for messenger RNA. And that messenger RNA is essentially a copy of your blueprint, which is your DNA, that is then used as a template to produce protein. And that protein is, you can think of it as a functional physical mechanism within the cells of your body. So they can be either in the cell cytoplasm or on the cell wall, and they do different things. They can be receptors, like receptors on nerve cells and muscle cells. They can be proteins that create structure for cells, like the proteins within the muscle cells, the sarcomers that allow for muscle contraction. So they're effectively physical structures within cells that achieve different functions. But once an mRNA is created, it is transcribed and floats in the cell cytoplasm outside of the nucleus, and it cannot re-enter or enter the nucleus at all. It gets produced outside in the fluid space of the cell and outside of the nucleus, whereon a ribosome is attached to that mRNA and produces the protein. So the mRNA is what has the copy of the blueprint. The ribosome is sort of the factory that attaches to that copied blueprint and then produces the protein. But the mRNA cannot go inside the nucleus and attach itself or integrate itself into the DNA. And so I think that is the source of miscommunication, therefore concern that an mRNA could go inside the nucleus and then manipulate or change the DNA.
Thank you. And I think we've got about half an hour here wrapped up. So can you just kind of summarize, we talk about kids wanting to go back to camps, participate in sports, hang out with their friends. We believe that the vaccine will help us to get to that much faster. What other things do we need to still be doing? I see we still have masks on here at the clinic. We've got changing recommendations as far as when you should and shouldn't wear a mask. Can you just kind of summarize those recommendations for us at this time?
Yeah, so, each state and each locality has kind of adopted different approaches based on the CDC guidelines that came out last month regarding need for use of masks in open air versus enclosed spaces if you're vaccinated. And so the central recommendation was, if you're vaccinated, there's no longer need to use masks in enclosed spaces. And so that was a new recommendation that was an expansion of, if there are individuals, all of whom are vaccinated within a closed room, they don't need to wear masks. There has been some increasing concern about a particular variant here in the United States and elsewhere, referred to as the Delta variant, that may potentially be more infectious and potentially resistant to the vaccine. And so there's been discussion about returning to mask wearing precautions for vaccinated individuals. But to date, that recommendation has not been made by CDC or federal guidelines. And so that's managed on a state-by-state basis. If they want that implemented at places of business and things of that nature. To my knowledge, here in Washington, there has been no return to mask wearing precautions in public spaces for vaccinated individuals. But that can be a decision on a personal level. If people find it not overly burdensome to wear masks in public and prefer to mitigate any risks by continuing to wear masks in public, that's certainly appropriate. But it is important for any members of the community who are unvaccinated to wear a mask whenever they are outside of their homes and in public. And that's essentially for the same reason that we've kind of described for non-vaccinated individuals, not necessarily requiring it any longer.
Well, thank you so much. I think we can kind of wrap up now. We've gone over a lot of the little kind of the myths and misconceptions associated with the youth COVID vaccines. We will be updating the website as far as when age groups change. Someone asked, when are we anticipating be able to vaccinate down to the 9-year-old range? We don't have exact information on that. It takes time and further layers of protections the younger you go. So I anticipate we'll have more testing coming and more information coming in the future. In the meantime, if anyone has questions about the vaccine, about COVID, please don't hesitate to call the clinic. We can set you up with a phone call with the doc for a phone call visit. If you've had exposures or concerns or just questions about the vaccine, absolutely call, please do. And we currently have vaccinations through the drive-through, as long as it's not over 90 degrees in the shade. We had a couple of those hot days lately. We have to shut the drive-through down. But otherwise, we have vaccines available in the drive-through area here by the clinic. They are not requiring an appointment. But if you've ever had a severe allergic reaction to anything that caused anaphylaxis or required an EpiPen, we do ask that you actually schedule and come into the clinic for that, for a little bit more monitoring for your vaccine. But otherwise, they're available through the drive-through. And again, please don't hesitate to call if you have questions about the vaccine or COVID in general. We are here to support you. And I'll hand it over to Ms. Charlene. And thank you so much, Dr. Hooper, for joining us today.
Thank you so much again, Dr. Hooper. Appreciate it. Thank you for Colrain for hosting today.